So, am I audible? Yeah, we'll be starting in another 2 minutes. So, I'll just introduce Deepika. So, Deepika Bhandari is a trained psychotherapist with a master's in clinical psychology and 3 years of experience in the field. She practices independently and is also the student counselor at Sophia College for Women in Mumbai. She practices from a trauma informed perspective and is also trained in the therapeutic modalities of REBT, Transactional Analysis, and Gestalt therapy. She is also trained in animal assisted therapy and frequently uses trained dogs in her therapy process. So let's start the talk. Deepika, over to you.
Okay, hi guys. Can you all hear me? In case someone can't hear me, just let me know. Also, I'm sorry about this, but my dog's sleeping in the background, so you all might hear snores. And he might show up in the frame as well. But yeah. Okay.
Sorry to cut you out. I request everyone to please put on the video.
Okay, so Tarun, whenever possible, please share the PDF and we'll just begin. Now, before we begin, I just want to mention that we're going to be talking about self-harm, we're going to be talking about addiction, and we're going to talk about its link to trauma. Now, all of these topics can be slightly triggering, so please be extremely notice how you are feeling, how you are doing in any situation. If it's getting too much for you or if it's getting too problematic for you, it's completely okay if you need to take a break, not listen to the conversation and come back. In case you want to be here for this conversation, engage in grounding activities. So something that you can do is put your feet on the floor, feel the floor beneath you and notice how you are feeling, or take some object, put it in front of you and notice it, like notice the dimensions, notice the texture, just pay as much attention as you possibly can to it. And if you feel like you need to say something or you need someone to have a conversation with, please feel free to speak to a friend or a family member. In case no one's available, please feel free to mention it on the call so we can take care of that. Now, that was before we start. And any questions that you have, I was thinking of taking them right at the end, but if you feel like you want to add a point while I'm speaking, please feel free to do so. There's absolutely no problem. Also, in case you disagree with something, please feel free to let me know. There is absolutely no need for you to agree with everything that is being said. And the last thing is that this is not going to be all inclusive. If someone has a history of self-harm or addiction, your personal reasons could be very different. So there's no right or wrong way to go about it. Okay, so let's start off. We're going to start off with the topic of self-harm. If you could move to the next slide, please. How many of y'all know what self-harm is or have known someone who has engaged in some self-harming behavior? If you don't, the definition's right there, but yeah. Anyone? This is a safe space, so if there is something that you want to share, you can. No? Okay, so self-harm is essentially some form of deliberate injury to your body tissue. Now here I'm not talking about self-harming behaviors. Here I'm talking about very, very simple what is known as self-harm in the cut and dry sense in psychology as per the DSM basically. Now, it's any intentional or deliberate injury to your body. So cutting is the most common form of self-harm where you take any sharp object, most commonly your fingernails, and you just create some scar or some scratch in an attempt to damage your own body. Okay. Other forms also include burning, scratching, or hitting yourself. Like a lot of people, what they do is maybe just take their palm or take their hand and they bang it against a wall. That also comes under self-harm in some way. Now, when this is just the definition as per the diagnostic criteria, as per the DSM-5, which is the latest version of the manual that's used to um, diagnose psychiatric conditions, there's something called non-suicidal self-injury disorder, or NSSID, which you can see in the last point there. That is something that comes forth, and all of these criteria come under this. Now, in earlier times, there was trichotillomania, which is pulling out your own hair, dermatillomania, which is pulling out your own skin, or injection of toxic substances, anything that was included. Now, with two other categories of disorders, substance abuse and eating disorders also cause some amount of harm to your body tissue, but they do not fall under self-harm because they are considered separately from this. They are considered as separate conditions in themselves. Now, before I go on to the relationship between suicide and self-harm, let's try and understand a little bit more about what causes self-harm, or what is happening inside a person's psyche when they're doing something like this. Now, very, very simply, a person who is self-harming, they are looking for a way for their feelings to be validated. They're looking for a way for them to feel that whatever is happening, they are present in the moment. Usually, what happens is that people start becoming extremely numb, and when you're numb, you do not feel anything around you. In that case, when you cause, I'm giving my wrist as an example because that's something that you can see, but this can happen anywhere on the body as well. Okay. Sorry. Now, when someone in that case engages in a self-harming behavior, it leads to some amount of pain. It leads to some amount of blood coming out. It also leads to some amount of endorphins being released in your brain. Now, all of these things make you feel present in the moment. They make you feel something. So they beat numbness in that way. So numbness is one reason why people engage in self-harming behaviors. Another thing is that in case there's something happening in your surrounding where you're extremely uncomfortable, but you cannot find anyone else to blame, okay? What you start doing is you start blaming yourself. When you start blaming yourself, you feel like you deserve to be punished. When you feel like you deserve to be punished, self-harming is one way that you can do so. That's another thing that we do. The third thing is when you are angry with your surroundings, but you feel completely out of control in your surroundings. Yeah? In that case, one of two things can happen. One thing is that you can have some amount of self-anger. When we say self-anger, you're like, oh, it's my fault that I cannot control my surroundings, which ties up with the self-punishment that we just spoke about. Another thing that can happen is you start getting angry at your surrounding, but because you're feeling so extremely out of control, you feel like I need to do something to get back in control, and harming yourself is one way that you feel like you can get back in control. Now, the last reason what I'm going to touch upon today when it comes to self-harming behavior is that you feel you want to completely break away and dissociate from your surrounding or from whatever is happening in the moment. In that case, what you end up doing is you harm yourself, and then all of your attention is focused just on that thing, and that's the reason that you can do better. Now, a lot of people believe that self-harming behavior is to get attention. That is most likely not the case, because usually people self-harm in places that you cannot see, or go to extreme attempts to cover any attempt of self-harm, to such an extent that people sometimes also make it a point to they do it in complete secrecy, and in case someone finds out, it's even more difficult for them, right? So not all self-harming behavior is to get attention. However, there are some people who are genuinely looking for attention, and for them, they would definitely have cuts or burns or scratches in places where, you know, it is visible, because they want someone to notice, they want some validation for their feelings. However, it is not attention seeking behavior that we've spoken. Now, everyone who attempts self-harm is not necessarily suicidal. Suicide is when you genuinely want to take your own life because you believe, you believe that you do not deserve to exist or you do not want to exist, right? Self-harm, on the other hand, is different in that way, because it comes on to a point that you want some expression of pain and you want some validation for your feelings. So people who have self-harm are not necessarily suicidal, but they may go one step further. However, more often than not, that's not something that happens. Could you go on to the next slide, please, Sarah? Okay. Now, let's talk a little bit about how self-harm is linked to other psychiatric conditions. So, in a research done, they found out, like, borderline personality disorder, one of the diagnostic criteria includes some amount of self-harm. It is also included in other personality disorders, because with personality disorders, we just want some expression of our pain. We genuinely want to be understood. Also, usually the diagnostic age of self-harming behavior showing up and personality disorders being diagnosed is roughly similar. Another thing is mood disorders. So with depression and anxiety, those are the two most commonly seen. Now with depression, sometimes what happens is that you start getting so overwhelmed that you do not want to feel anything, and then you go to the stage of numbness. And when you go to that stage of numbness, or you go to extreme self-punishment, in that case, you could have self-harming behavior can start showing up. With substance abuse, this is usually for people who use intravenous injections to inject substances into their body. For them, you're already harming your body in some way, you're causing body tissue damage. And sometimes they go one step further in attempt to feel something or to feel better. And it is also seen in cases of PTSD and abuse, which I'm going to touch upon a little later, so I'm not covering here. Okay? Now, self-harming behavior is more common in females. So there does exist a statistic that it is 5 times more likely. But in recent times, it's been noticed that since it's being reported a lot more, and it's found that, you know, this statistic, this balance is kind of coming to a very, very similar front. So possibly it's more reported in females instead of being more common in females. Here, the age mentioned is 12 to 24, but it can start earlier, it can start later as well. And as we mentioned in the causes before, it is often a coping mechanism from overwhelm and your own surroundings. Yep. Does anyone have any questions about self-harm so far? Because we're going to go on to addiction right now. Or should we take questions once right at the end? Actually, you know, right at the end is better. Tarun, could you please move to the next slide? Now, when we talk of substance abuse, or more commonly known as addiction, it's essentially the compulsive use of substances despite harmful consequences. And it could start because of a bunch of reasons. So when we look at substances, there are substances that make us more active, and there are substances that make us a little more dull and, you know, help us. So some people start taking substances because they want to feel better, they want more energy, they want to do better. So, you know, you need that additional help. Like the most basic example is coffee. You sometimes drink coffee or tea, whichever you prefer. You sometimes drink that if you want to pull an all-nighter, or you want to study longer, or if you want to just be more active during your day.
or she'll be back in a minute, or internet lagged out, she'll be back in a minute.
Hi, sorry about that. Some problem with my laptop. Audible?
Yes, ma'am, you're audible.
Thank you. Thank you. Okay. So we were talking about substance abuse, right? And sometimes you just want to perform better, you just want to feel better, and that's why you want more energy. That's why you engage in a substance. Sometimes you just want to stop thinking, and you just want things to like, I just want to go to sleep. In that case, it also does show up, and you usually what most people rely on is alcohol because you just want to go to sleep. Now, it also mentions curiosity and peer pressure. That's usually what people do. That's usually why people start taking substances because, people are like, oh, I tried this and I felt really good about it. And you're like, you want to know what is it all about? And that's something that you try out. Now, that is curiosity and that's trying a substance. You just try it on one occasion or you occasionally do it. When we talk about abusing substances, we talk about it going beyond a certain level, which is why it's a compulsive use. Now, everyone knows that all of these substances are addictive, which means that once you take a certain quantity, your threshold increases, and that's why you start taking larger quantities every single day. That is, if you are taking them every single day. And then at one point, it becomes your body's need because it does alter brain chemistry, it does alter the functioning of hormones, because that is something that it hits. That's when it becomes a need in your body, it becomes compulsive, and it starts having consequences. So when you are compulsively using substances, you cannot function without them. That is when it becomes, that's when it reaches a stage of addiction. Now, how can it manifest? It can manifest as impaired control. When we say that, it means impaired control of yourself, your moods, your anger, your skills in a social situation, in all of those things. Or it can also manifest as impaired control of your thinking, speaking, or so it shows up as control issues in all aspects of your life. For example, someone who has taken extreme amounts of caffeine, which is also a substance at the end of the day. So caffeine is found in both coffee and tea. Sometimes they start talking so fast that you cannot understand or hold on to what they are trying to say. In that case, you sometimes are able to control that behavior, sometimes you're not able to control that behavior. Now imagine this tenfold. It also shows up as social problems. So when you obviously are unable to control your own behavior, it will show up as social issues, it will show up as concerns, it will show up as in different aspects of your life. Your relationships will start getting affected. It's going to have an effect on every single aspect of your life, primarily in the social aspect, because people will also start figuring out that there's something that's going wrong. The third thing is risky use. Now, when something has become compulsive, something has become a need for your body, no matter what, you are going to try and obtain that substance. Now, if that means taking huge money loans, if that means putting yourself in unnecessary risk, if that means using unsanitary needles, for example, or looking for cheaper options which could potentially be dangerous, it could just show up in any way. And the last one is withdrawal effects. Because the risky use usually comes in because you do not want to deal with the withdrawal effects. And that is because, again, it's become a need for your body. It's a good idea to try and understand this with respect to food. When you are hungry, and if you see a lizard sitting on the wall and you're like really, really scared of lizards, you will still go pick that plate of food that's sitting under the lizard, right? Because you are that hungry. In the same way, you would do anything to get a substance when you really, really want it, really, really need it. And this has been demonstrated in several films, it's demonstrated in several videos of people who are dealing with addiction. It also definitely distorts your body functioning and thinking, as I mentioned in the point with impaired control already. But let's look at some of the reasons why people start doing this. One is that they want to either stop feeling so much or they want to feel something. Once again, your reality has become too much or too difficult for you to deal with, which is why you need a break from it. If you need a break from it, you do something very, very extreme to get away from it or to be able to deal with it. Another thing is that you think that you are anyway worth nothing, you don't deserve to be here, you have done some terrible, terrible things and you're looking to punish yourself. If you notice, these sound very repetitive when we spoke about self-harm also, right? Because when I said that I was talking about self-harm and I'm talking now about self-harming behaviors. In one way, addiction or getting addicted to a substance is also a form of a self-harming behavior where you're engaging in a behavior that will cause or manifest as some harm to yourself. In the same light, we talk about self and other anger as well. When you get extremely overwhelmed in a situation, you're like, okay, I'm going to take a shot of this or I'm going to ingest this substance because it will either make me feel in more control or it will punish me as I deserve to be. And once again, sometimes you just want a break from the situation and that's why you dissociate or you engage in this. Could you please move to the next slide? Now, substance abuse always progresses in stages. So it's not like you are going to get addicted the first time you take a substance. It starts very, very gradually. So say, I'm going to talk about cigarettes. One day you're with your friends, they're all smoking and you want to try a cigarette. So you try it, you take a couple of puffs. The next day you go one more, you go one level higher, you have an entire cigarette yourself, so on and so forth. Your behavior gradually increases. Now, nicotine, which is the compound that's found in cigarettes, has had an impact on your body. It's extremely relaxing. It's making you feel much better. And now gradually you feel the need to take a cigarette. Now, so far, it's also not gone to the stage of substance abuse. Here, you're feeling the need. However, it's not become compulsive. If you stop at this stage, you would have some problems, but it's not going to continue for a long period of time. However, if you don't stop, you gradually increase the amount, and as and when it gets to a certain level, your functioning is impossible without a pack of cigarettes or without taking at least one cigarette a day. That is when it becomes abuse. It reaches the stage of addiction. Quitting at that time becomes extremely difficult. Now, looking at this, also you'll notice that the researchers here are really, really old because addiction has been looked at for the longest possible time. Well, people haven't been able to come up with the best ways to deal with it. Now, family history. If you have seen substances being used and abused in your family, you will automatically be at a higher risk for taking them. In fact, researchers also suggested that it has an impact on, it has an impact that children with parents who have a history of substance abuse often show up with certain brain chemistry changes. Difficulty coping with surroundings, those are the points that I mentioned earlier, where you either get really angry, you want to dissociate from the situation, you want to feel something, you want to perform higher. In any of those cases, that usually shows up. Now, tied up to this is the next point, which is, Rajni, I do note your question. Can I answer it right after I'm done? Yeah. Now, an underlying mental health condition, usually when we have a mental disorder, we automatically start feeling out of control. We feel like we're unable to deal with what is happening in our surroundings. And that shows up, that often brings us to this thing that I want something to be able to get away or to be able to deal better with my surroundings. And that's when you start using a substance and it can turn to abuse as well. A history of trauma. This is another situation where you completely start feeling out of control and you are unable to cope with your surroundings, or it shows up as numbness. I'm going to touch upon this once again later, and we'll go with that as well. Now, research has shown that approximately 10% of the population has some form of substance addiction. Um, and very, very often it's a misconception that lower socioeconomic strata would have more instances of substance addiction. However, that is not the case. There is no socioeconomic link. It's again maybe misreported, more reported, or because their situations are so much more difficult than ours that it becomes difficult to deal with it, and that's why they're more likely to fall into addiction. Also, because if you look at the peer group, if say one person is doing it, it automatically shows up, oh, okay, you are able to deal with your situation, then even I'm going to take it, and so on and so forth. Once again, there is no gender link. Again, it is more commonly reported in men, which could again be a misrepresentation because of reporting, or men are more likely to do so because it's presumed that women are not as open with their substance abuse, and their form of substances also take a different front in some cases. Okay, so I'm very quickly going to address Rajni's question, which was, does a strong mind or self-control help in reducing substance abuse? Or once you reach a certain level, it's difficult to curb the want? That's a very good question. And as I think you already mentioned in your question, that it depends on which level you are. Now, if say you've reached the stage where you compulsively feel the need for substances, but it's not reached such an extent that it affects your functioning. At that time, if you make a strong resolve and you have something which is very, very important, which is social support, then you are likely to be able to stop that if your resolve is strong enough. But I think in those cases, social support becomes a very, very important factor as well. But when it's become a compulsive need, that's when I think additional help and psychotherapy would be important as well. Okay, there are multiple questions as well. Okay. You've been smoking for 10 years and you want to quit now. Is there any psychotherapy for de-addiction? Yes, I will be covering this in detail when we talk about dealing with these issues, but definitely there is psychotherapy available. In fact, group therapy is also recommended for de-addiction. There are people who specialize in de-addiction only, so you can definitely look that up as well. A lot of people are also now going back to apps because they have a dedicated person who will check back with you multiple times about how you're doing. So that also helps the process. For smoking, there's something called Quit Buddy, which is a Bangalore-based startup, which you can check out as well. Could I talk about the advantages and disadvantages of going cold turkey? Advantages are definitely it's something that immediately stops, but the disadvantages are that you definitely deal with the withdrawal effects much, much, much more. And sometimes the withdrawal effects get so extreme that it brings you back to the habit. So what I would suggest is, even if you are going cold turkey, it's a good idea to maybe do so with the help of someone, so that you have someone who can help you maintain your resolve. That could be, now depends on the level of addiction as well, but it depends on the number of again, it depends on the stage that you're in. Most likely, psychotherapy with going cold turkey does tie up very well. How can I help a friend who I know practices self-harm and confides in me? Now, this is a very good question, and thank you for bringing it up. I was going to cover it in detail later, but I'm going to now. One is that in case you know someone who is self-harming and they are confiding in you, it's a huge thing because they are trusting you to a level that they feel comfortable to tell you. So the first thing that you can do is listen to them and listen without judgment. So don't be like, oh my God, why are you doing this? Don't do this. Stop doing this. You don't deserve this. Yes, I agree and I understand where you're coming from. But at that moment, they need you to just listen to them without judgment. They've been able to trust you for a reason, and continuing that reason is the best idea. The second thing that you can do is check in with them and see to what extent are they self-harming. Now, if I'm going to explain this with the example of cutting, but in case it gets to another level, then we can it's also applicable in other things. Sorry, I got distracted by a question that came in. Now, if the cuts are only on the surface level and they're not piercing or they're not going to a very extreme level, that is something that you can understand and be like, okay, fine, this is something that's happening, and maybe you can address it or talk to them about getting help. However, if it's going extremely deep, if the gash is so deep that it could prove to be fatal at another point, in that case, the urgency to seek help becomes extremely important. The next thing that is important is to understand what is causing this. So try to, when you're listening to them, they will most likely also come up with the reason why it's becoming so difficult for them to be able to cope with their surroundings. Usually it's a coping related thing. So check in with them, ask them what is it that's bothering them, and then gradually guide them to maybe seeking help for it. Now, if they do not have if they do not have a good relationship with their parents, do not force them to confide in their parents. What you can do is maybe find a trusted adult and ask them to confide in them, and then who can help them access the help that they need as well. I hope that answers your question. And even when they start taking help, what they would need from you is support and kindness and care. However, at no point is it your responsibility to be able to deal with their issue. So in case they are self-harming, they're confiding in you, but they're taking no steps to move forward with it. Yes, it's extremely difficult for them to take those steps, but it is not your responsibility to be able to have to deal with it. Can junk food addiction be classified under substance abuse? Not at particular, because junk food is still not being recognized as a substance. However, yes, it's a very, very real concern, and that is something that a lot of people do go through. So even when it's not under substance abuse, it is something that's harming your body, and it is coming in as a compulsive need as well. So I would say in the behavior, yes, it can. As per the diagnostic criteria, it can't. Okay. In case of it happening in the moment and they are telling us, contacting the authority. Okay. Could you please clarify, is this about self-harming or is this about the addiction question, please?
It's about the addiction question.
It's about the addiction question. Okay.
No, sorry. No, it's about the self-harm question. Sorry. Yeah.
Thank you for the clarification. In case it's happening in the moment of them telling you, I think at that moment, be there for them. Just listen to them. they would most likely need validation for their feelings. So just talk to them. Also on YouTube, there is one video which I will link to one of the people from the club that I'm in touch with, that talks about forming your own self-harm coping kit. Because when you are overwhelmed or when you are dealing with something, you are unable to think of any coping technique at that moment. So what you can do is simply go back to that, and you can think about you can just think about and relate to one of those. Okay, I think there was another question. Which substances would you classify as capable for substance abuse in cases of drugs primarily? Okay, so you have your stimulants. So that's cocaine, amphetamines, Ritalin, all of those things. Heroin, sedatives, hallucinogens, ecstasy, Valium. I think the whole list that we most commonly know, all of those would classify as substance abuse. If you just type it into Google, you'll get the entire list. Okay, I'm going to move forward, and then as and when questions come, we'll address those as well. Tarun, could you please move to the next slide? Yeah. Now, when someone has been through any traumatic experience, some of the things that they most commonly face are a lack of social support, a lack of understanding, a lack of feeling in control in their own surroundings. They are unable to explain or understand what is happening, since usually when now some forms of abuse definitely do leave physical scars, but when those scars heal, people are unable to understand what or why is causing them to still be affected in to the same extent that they were initially, right? And trauma leaves more emotional scars than physical scars, and a lot of people do not understand the extent to which this goes. And that's why with people who've undergone trauma, more often than not, you see self-harming behaviors and addiction behaviors increase to a very, very great extent. They are struggling to manage the effect of the trauma. They also do not have people around them who understand. Now, I'm going to break this down a little bit more. One is that I see your questions. I will address them later. So just keep putting them. That's completely okay. Yeah. Now, when someone is going through a traumatic experience, or they are dealing with the after effects of a traumatic experience, what happens is that they themselves are not able to make sense of how are they feeling, why are they feeling what they're feeling, and everything that they're going through. There is extreme amount of pain, there's some amount of guilt, there's some amount of invalidation, saying it happened, now why is it still affecting me? There's a lack of understanding. You feel like your roots have been completely uprooted. You're unable to manage your own emotions. Things get overwhelming. Sometimes what happens is that you flash back to the experience in itself, and you're unable to deal with it. There are sleeping issues. There are nightmares. It's a whole list of things that happen. Okay. You are unable to make sense of it yourself, which means when you try to explain it to someone else, they are also unable to make sense of it. And what happens in that case is extreme invalidation of how they're feeling in the situation. I've had cases who've come to me where the people that they've confided in about their traumatic experience have also refused to believe them. With that level of invalidation, we automatically start feeling out of control in our own surroundings. At that moment, one of three things can happen. You want to feel something different, which is why you engage in this kind of behavior. You want to feel absolutely nothing, which is why you can dissociate from the situation. Or you have so much anger that you've completely turned it inward. And when you've turned it inward, you start punishing yourself in some way by either abusing a substance or harming yourself. One other thing that it can show up as is an eating disorder, but that we're not covering right now. Okay. When we talk about childhood abuse and neglect, now those leave scars which are far deeper than actually, you know what? There's no comparison, which are extremely deep and they make you feel much. They make you feel invalidated because childhood neglect in itself will make you feel invalidated, where your primary caretakers have not responded to your basic needs, which is when these behaviors show up so much more, and they also take more time to work through because there is this baggage that we're dealing with. So a good idea is also to check in with with people about how they are doing. Ask them if there's a history of trauma, and you can also then see if someone is doing better. Again, emotional dysregulation is a common factor, and what's worse is that self-harming behavior and substance abuse can coexist together, both of them affecting the other and making the situation far worse. Could we move to the next slide? In the meantime, I'm going to answer the two questions that have come in. How do we point out to a friend who might be abusing a substance without thinking it's problematic for them? Which is most likely the case that happens. Someone doesn't even realize that they're on the path to getting addicted. Now, it depends on your relationship with the person. Sorry, just give me 1 second. I've been getting this persistent call. So I'm so sorry about that. Yeah, so I was talking about someone who's abusing substances. Usually what happens is people do start abusing substances and they do not realize it's becoming a compulsive need. How do you point this out? Now, it depends on your individual relationship with that person. If you have a deeper relationship with that person, it's a good idea to check in with them, tell them that, I've noticed that you've been doing this to such a great extent. What's going on? Is there something I can help with? So check in with them, point the behavior out to them, have a conversation about it, and then maybe guide them towards getting help or quitting whatever they need. Now, if this is a person that you do not know, once again, the path that you follow would be very similar. But what you can definitely tell them is that, I do not mean to belittle you. I do not mean to tell you anything. 1 second, guys, I'm sorry. Once again, sorry about that. Yeah, we were talking about yeah. So don't tell them that, because it's very likely if you do not know this person very well, they're more likely to get defensive else. Sorry guys, one second. Sorry, I had an extremely confused delivery guy on the phone who was unable to figure out where to deliver something. Moving on. Yeah, so with a person you do not know very well, it's very likely that they may get defensive. So just tell them that you're coming to them as a safe person who's having this conversation with them. Once again, ask them how are they doing, and tell them that this is the behavior that you've been observing, and maybe guide them to help. Always make sure you're not doing this in a group of people. Talk to them one-on-one personally. Do not come at them. Again, if you are a very, very close-knit group of people, you can have one or two friends so that, yeah, sorry about that. You can have one or two people who can have that conversation with them to make it more this thing. Once again, you cannot push anyone to get treatment, and it isn't your responsibility to save them. You can provide support, you can be there for them, you can offer your help, but beyond that, it's very difficult for you to do something else. Now, with more and more people getting addicted to their phones, does this lead to self-harm in the future or the need for social validation? That's a very, very, very good question. Um, I don't think it necessarily leads to self-harm, but something that it definitely does is increase your need for social validation. And that's why it increases the instances where you feel like you are not being validated or your feelings are not there. And it may turn into self-harming behavior. It does not necessarily do so. But another thing that's also happening is that a lot of people are now aware of this, which is why sometimes what they do is they turn to self-harming behavior out of curiosity and then realize that it makes them feel better. And now, I'm not saying that there isn't enough information out there that prevents this from happening. Yes, there is. But there is also a lot of information out there that brings this up as an option, and that's why sometimes people may engage in this behavior. Okay, I'm quickly going to move on to treatment. Now, one thing is definitely to introduce positive coping or introduce some form of coping for the person. Now, sorry, this could show up in either coming up with a coping kit, replacing the substance with something else. So distraction is one of the things that can work, or it can definitely look at maybe every time you feel the need to smoke a cigarette, you go take a walk, which produces similar feelings of doing much better, or you have a cup of tea, something of the sort. So you are coming up with a coping mechanism. Usually what people do is they create a coping mechanism toolkit and you automatically feel better. Another thing is definitely improvement of communication skills. Now, a lot of people who are unable to deal with things, what happens with them is that they are unable to talk to people about it. Once you improve your communication skills, or you feel like you give vocabulary to what you are going through, you can explain it to people a lot better, which happens through psychoeducation. So you go up, read up about it, watch YouTube videos. They're a great way to educate yourself. Get in touch with more people who may be dealing with the same thing, may go out of the same thing, may have dealt with the same thing in the past, or are aware of these things, know someone who's been through this. But all of this is possible only and only when we start reducing the secrecy around these things. What you can do as a person is become a safe person, don't invalidate their feelings, listen to those people and have those conversations with them. Another thing is, if it's stress-induced self-harming or stress-induced substance abuse, you can understand that reason, pinpoint it, and start reducing that stress. Now, if you say that work is getting so difficult for you that sometimes to cope with the work situation or feeling out of control at work, you start drinking too much, for example, or to reduce the work stress, you are smoking a cigarette. In that case, you can definitely make those changes by reducing your work stress. So automatically the effect that happens. Another thing is accessing treatment. Now, for substance abuse, there are some de-addiction centers that are doing a wonderful job. In fact, when I was looking up this talk, I think I came across this one center that also has a parent-child support group for people who are dealing with self-harming behaviors. So, you foster a better connection between parents and children to be able to deal with this. Counseling is something that works wonderfully. It helps you come up with different coping techniques. Look up a counselor. Ensure that that's someone you feel safe with, you feel comfortable with, you feel like you can share anything with. If you feel like your counselor is judging you, if you feel like they're not paying attention, if you feel like they are being um, maladaptive to your mental health, they're pushing you too much, one, you can definitely have a conversation with them about it, or you definitely can look for someone else. The next point is extremely important. Both of these conditions, self-harming behavior and addiction, are extremely isolating conditions where you feel like you're the only one who's going through this. Group therapy is a great way to be able to deal with this better and to be able to understand what is happening in a better manner. So you can either look for self-help groups or you can look for group psychotherapy, which is much cheaper than traditional psychotherapy as well. And you can work through that better. Another thing is medication. Sometimes we're unable to deal with it on our own. Sometimes we need medication to be able to help us. And if, usually when I mention medication, one of the questions comes is that, medication also alters brain chemistry and you can get addicted to psychotropic drugs as well. So then is it a good idea? I would still say that it is a good idea because your psychiatrist definitely checks in with these things and they also modify your dosage as per that. So that's something that you can explore. These are some of the treatment strategies that are available, but there is a lot more that can be done. We live in an age where there is a boom of information. We have a lot more coming in, and because of that, we're able to understand and deal with these things better. But there's still a need to reduce the stigma around them, to have more conversations, to be more open, to not touch upon these topics as though they are taboo, or you can only mention them to very, very few people. Have as many conversations as you can, but at no point push a person beyond a level that they can go or they can deal with something. Yeah.
Ma'am, should I stop sharing the screen?
Sorry?
Should I stop sharing the screen?
Yes, that's absolutely okay. Okay. Any
You
questions?
can answer. You can take one or two questions from the chat box, and then we can wind it up.
Gotten no further questions. I've answered all of the ones that have been asked. But if there are any more, please feel free. I'm just checking. Yash's question was the last one.
Yes, ma'am.
So if someone wants to take some time, gather your thoughts, please put forth more questions. You don't have to put them in the chat box. You can just ask them as well. In case you're uncomfortable of putting them to everyone, you can private message them as well. Yeah. Okay. Can I talk about energy drinks being addictive? Yes, yes, they definitely are. A lot of energy drinks have caffeine in them, and they do not have very regulated amounts of caffeine, so they can easily become extremely addictive. And it's a growing problem that's happening. In case you notice someone doing that, definitely there are alternatives. There are caffeine-free energy drinks that are available as well. So maybe that's something that can be looked at. Um, but yeah, energy drinks becoming addictive is a very, very real concern. Where can you find self-help groups in real life? Because apps have not been very, very useful. Well, with self-help groups right now, as far as I know, most of them are online, and I'm not sure how many of them are functioning as well. I know Messina Hospital has a de-addiction outpatient clinic sort of thing where you can go and you can definitely have conversations. And Messina is within Mumbai because most of the other de-addiction centers are on the outskirts or far away. But the currently functioning self-help groups, give me some time and I will get the information to either Tarun or Arushi and they can forward it to you. Is that okay?
Yeah, you can share it with me. I'll do it.
Okay. The ones that are currently either doing online sessions or are working right now, those are the ones that I'll definitely get in touch with. Um, Self-sabotaging behavior, what does that fall into and how to not engage in them? That's a very good question. Now, we did not cover the topic of self-harming behaviors. Now, self-sabotage is a form of self-harming behavior as well, where what you are essentially doing is you are engaging in behavior that would, in a way, harm you at a later date. So, with relationships, you are possibly stepping out of relationships before anyone else does because you do not want to go through the pain of dealing with a relationship ending. That is a self-sabotaging behavior that does not cause any physical harm to you, but it definitely causes some amount of emotional harm to you. Again, I would address that problem as I would address any problem that you go through. So, what you can do is try and understand the underlying cause beneath it, understand what is happening, why are you doing this behavior, and in case you're unable to do this on your own, maybe seek some amount of professional help where you deal with this better. Okay, companies are
Ma'am,
getting
can we take the last question? We are running out of time. If that's
okay.
okay with you.
Sure. Um, so I'm gonna address all three of them together in that way. Okay.
Will do.
Yeah, I think everyone can read the question. Um, to control consumption of any kind of product, and in fact in that way social media as well, I think a good idea is to limit the number of hours or to limit the number of cups of tea that you would be taking. So say, I would be on social media for 1 hour a day. In that way you can try and do that. Or I would have this product once in a week, or I will only have 2 cups of tea. And then once you start bringing the time of that closer, then it helps you deal better because it deals with your headache. And how can you help someone who's not motivated to stop self-harm at all? That becomes extremely difficult. Maybe they're going through something that's more difficult for us to understand. What you can do is be there for them, be a safe person for them, tell them that help is always available if they choose to do so, and then see what they decide to do because that has to be their decision. You've been a great group. In case someone has more questions, Tarun has my contact details. Please feel free to email them and I can respond to you.
Yeah, so you can always reach out to either of us in the club. We'll attach the email ID or someone's phone number. You can give us the question and we can forward it to ma'am and then we can take it from there. So yeah, so I'll give the vote of thanks. So you're good. Thank you to all our collaborators for today. Archie, Rotaract Club of Khalsa College, Rotaract Club of Podar College, and Rotaract Club of Shivaji Park. We are grateful for your time and commitment. Thank you to Ms. Deepika Bhandari for sharing your time and talents with us. You explained the concept behind self-harm and addiction and how to do away with it in great detail. And I can vouch for everyone here that we leave today's workshop with so much more knowledge and empathy. Rotaract Club of Mumbai Nariman Point is really thankful to you. We hope that everyone here had an informative evening and is looking forward to more such talks in our upcoming event. Ayna, Heal Thyself, we wish you a great evening. Heading on to the main event, which will be on 10th and 11th of October, which, which, which is going to be the name, going under the name Heal Thyself. I'll tell you guys about some workshops and talks which we will be holding. So we will be having one heart-based therapy workshop, body positivity workshop, talking to someone who's dealing with mental health problems, and interactive therapist sessions, which includes a panel discussion as well. For all parents, we have sessions on parenting and raising resilient teenagers. So thank you all for coming over here and spending your beautiful evening with me. Thank you, ma'am, for giving your time.
Thank you so much. You've been a great audience and you've been really comfortable to coordinate with Tarun.
My pleasure.
Right. Thank you, guys.
Thank you.